When we say autoimmune disease, that means the body is acting on the self and mediated by either antibody production or cell toxicity in absence of any other disease. Then only we call it as autoimmune disease. Have you understood? So, in this case, a 30-year-old female came to the hospital with complaints of generalized anasarca, abdominal pain, right sided hip pain, rashes over the body, on the face. If you can see, there is a rashes both over the nasal prominence and on the cheeks, and the whole process has been going on for about 1 month of duration. On examination, we have found that she is having bilateral pedal edema along with ascites. Furthermore, she also has, on tested with CT scan, we can find bilateral pleural effusion, hepatosplenomegaly and ascites on USG. After the tests were done, something was found that is called as ANA and anti-dsDNA antibodies were found. This gives us the diagnosis of an autoimmune disease called SLE or Systemic Lupus Erythematosus. Now, what is this SLE? It is an inflammation of connective tissue. What were the antibodies? Anti-dsDNA and ANA, anti-nuclear antibody. That means her body is producing antibody against nuclear membrane and the DNA itself. Thereby, these antibodies will affect almost all organ systems, from nervous system to skin to gastrointestinal system, every system of the body. We start looking at autoimmune diseases. There are various types of autoimmune diseases. This may affect many organs, multiple systems at a time, may organ a particular single system, may affect a single organ or multiple organs. And there are many types of autoimmune diseases. For example, can you name some? Rheumatoid arthritis, anything else? There is autoimmune thyroiditis. Have you read about hyperthyroidism, where a single organ is affected? It could also be diabetes mellitus, that is type 1 diabetes mellitus, when a single organ is affected, or it could be like multiple sclerosis, where the central nervous system is affected, one particular system, or it could affect multiple systems like SLE or rheumatoid arthritis. Now, why is it important? If we look at the prevalence of autoimmune diseases, as we are coming to know about more and more autoimmune diseases, we can find that the prevalence of many autoimmune diseases are significantly high, and it does contribute to significant morbidity and mortality. The autoimmunity was first described by Paul Ulrich, and he called it as horror autotoxicus. Now, this is what happens. This is the B cell receptor. When the antigen comes, it starts producing antibodies, and if that antigen is presented by the antigen presenting cell, it will trigger the T cells to form the helper T cells and the cytotoxic T cells. The helper T cells will further accentuate the production of antibodies. Now, if this antigen is a self antigen, then what will happen? Antibodies against own body will start forming, and when these antibodies are targeted, local tissue destruction happens. Now, when we are talking about autoimmune disease, that means it should not happen normally, right? It should not occur normally. So, how does the body prevents the occurrence of autoimmunity? This is what we have to understand today. This happens because of a phenomenon that is called as tolerance, and we call it as immunological tolerance. So, what is tolerance? Tolerance means the immune system does not activate against the own antigens. Okay, it will activate only against foreign antigens, and it happens in two methods. It can be divided into two parts. One is called as the central tolerance, another is called as the peripheral tolerance. Now, central tolerance means during the development of both B cell and T cell, there is some modification or changes. Those are called as the central tolerance. And what is peripheral tolerance? After the modifications done in the central mechanism of central tolerance, if some of the cells does escape out, it is further modified in the peripheral tissues. That is called as peripheral tolerance. Okay. Now, this is the flow chart. The first is the central tolerance, where lymphocytes which are directed towards self antigen will be removed from the body. If some of them are escaping out into the circulation, those will be removed by the peripheral tolerance. But if there is any problem in recognizing during central tolerance, what will happen? Cells which can recognize self antigen will come out in the circulation and cause autoimmune disease. Similarly, if the peripheral tolerance fails, the same thing might result. So, this is the basic defect in autoimmune diseases. Now, for we have two types of cells, B cells and T cells. Both these cells originate from stem cells that are present in the bone marrow. For the T cells, these progenitor cells will move to the thymus. And what happens in the thymus? We have T cell maturation. That is, the T cell matures. Now, look at over there. In the thymus, initially, the T cell does not have any receptors. We call it as কি বলা ওগুলোকে পড়ানো হয়েছিল তো we call it as the double negative T cells, right? Neither CD4, neither CD8, none of them are present on these T cells. What happens is these T cells will mature and will acquire both CD4 and CD8. But some of the cells will not have these cell receptors. So, they will be removed from the circulation. Only cells which have CD4 and CD8 in their receptor cell, those will be selected. This is called as positive selection. Now, what is the role of these cells? You can cell receptors, you can see these cell receptor, they act as the cell receptor and will attach with the antigen presenting cell with the help of MHC2 molecule. So, if any cell which does not have either CD4 or CD8, that is double negative, it cannot bind with the antigen presenting cell. So, it will be ineffective, hence it is removed. Now, what are left are cells which have CD4 and CD8. Thereafter, the cells will mature to form either CD4 or CD8 cells. What happens after that? The antigen presenting cell present in the thymus will expose the antigens to these cells normally. But difference over here, in the peripheral tissue, the antigen presenting cell exposes foreign antigens. But in the thymus, we call it as the AIRE, autoimmune regulators. What they do is, these are the thymocytes. These are the self antigens which are present in the human body. So, to these cells, the antigen presenting cell will present these self antigens to the T cells. These T cells will bind and will bind with the antigen presenting cell. Now, what happens after that? The binding is assessed. if the binding is very strong, that means a particular T cell can recognize self antigen very strongly. That means it's a dangerous type of T cell. Hence, it should be removed. So, this cell undergoes negative selection and undergoes apoptosis. Have you understood? Suppose there is weak binding, the binding may be weak. If the binding is weak, then this cell is positively selected and sent into the circulation. That means it can recognize self antigen, but it cannot bind very strongly. So, any human cell which is infected or defective, they can be recognized by these T cells and can be acted upon them. However, on normal cells, they will not act. This is what is the positive selection. Some of the cells will have intermediate level of binding capacity. They mature differently and they form what we call as the regulatory T cells. Till now, have you understood? So, any T cell which has a very strong affinity to self antigens will undergo apoptosis. Now, what happens to the B cells? The B cells B cells originate in the bone marrow, and within the bone marrow, suppose inside the bone marrow there is a B cell. What does the B cell do? After it recognizes an antigen, it will start producing antibodies. There are antigen presenting cells like a macrophage within the bone marrow. It acts as an antigen presenting cell. Now, this B cell, when exposed to the antigen, will produce antibodies. Now, if these antigens are self antigen, it will start producing antibody. Now, these B cells will undergo three mechanisms. The first mechanism is there will be what is called as the B cell receptor modification. That means the B cell receptor will be modified. The receptor means the receptor which attaches to the immunoglobulins, that will be modified. So, if there is a modification, what will happen? It can no longer recognize the self antigen. So, most of the B cells will undergo this receptor modification. Okay. And if it fails, some of the B cells may fail to modify the receptor. So, those cells will undergo apoptosis. Understood? So, these are the important mechanism that comes under the central tolerance. Some of the cells in which both receptor editing fails, they become what we call as anergic state. That means they remain over there, but they fail to produce antibodies. That is called as anergy. Okay. Now, let us look at the peripheral tolerance. What is, do you understand by peripheral tolerance? First is ignorance. Now, please keep in mind, both in thymus and in bone marrow, the antigen presenting cells expresses the self antigens, so that any cell which can recognize self antigens will either undergo apoptosis or receptor editing or anergy. But suppose there is a self antigen which is not expressed either in thymus or bone marrow, what will happen? The immune cells have never been exposed to those antigens. So, when the person grows up into an adult and this antigen is exposed, his body or her body will start acting against this antigen. This is called as ignorance. Next is called as anergy. Now, for anergy to happen, there are some receptor like the CTL4A and B7. Normally, the CD cells will bind CD markers will bind the T cell with the antigen presenting cell and start the reaction. However, if there is a linking of the CTLA4 and B7, there will be anergy of the T cells. That means the T cells will no longer progress to produce either cytotoxicity or influence the B cells to produce antibody. Now, suppose there is a modification of this B7, what will happen? This suppression will not happen. Next mechanism is called as phenotypic skewing. That means the self-reactive T cells interact with the antigen presenting cells, undergoes full activation, but because of secretion of the certain cytokines and chemokines. What are cytokines? These are the mode of communication between these cells. So, some of the cells will some of the cytokines will down regulate, hence the reaction will not occur. Furthermore, there another thing happens, it is called apoptosis by AICD. Now, there are some ligands called as the first ligand. If these attach during attachment to the antigen presenting cell and the T cell, this cell will undergo apoptosis. Okay. Next, I have already told you in T cell development, one type of T cell develops to become the regulatory T cells. These regulatory T cells can downregulate by production of certain cytokines like interleukin 10 and TGF beta. Similarly, some of the dendritic cells can also downregulate. Last but not the least, in our body, there are some cells which get sequestrated. Sequestrated means during the development, they remain in certain part of the area which is not connected either by blood or lymph nodes. And when that happens, those antigens are never exposed. A very good example would be the corneal tissue and testis in case of males. They never come in contact with blood or lymph nodes. Because they never come in contact with the lymph nodes, hence those antigens behave like a foreign antigen. Now, this is what we have learned about the tolerance, that is the central tolerance and the peripheral tolerance. Now, let us understand then how this autoimmune reaction happens. The first is the breakdown of T cell anergy. Anergy means, I have already told you, there is a co-stimulatory factor, the B7. If the B7 is present, what will happen with the CTL4A? The cell will undergo anergy, that means it will not perform its function. However, if it expresses the co-stimulatory function, then we can find diseases like multiple sclerosis, rheumatoid arthritis or psoriasis, where even a small tissue destruction, if it happens, then self tissue antigens are processed and body starts producing antibody against them. Or we can find what is called as the failure of the AICD, where the autoreactive cells, they fail to undergo apoptosis. If this happens, we can find for example, a disease like systemic lupus erythematosus. Again, I have already told you, regulatory T cells downregulate by interleukin 10 and TGF beta. If the regulatory T cells have a loss of function, then downregulation does not happen and body starts activating. The next mechanism is called release of sequestrated antigen. I have given you the example of sequestrated antigen like the cornea and testis in males. Now, suppose because of say trauma, a person receives an injury to the eye and there is a rupture of cornea. Now, the corneal tissue will come in contact with the blood. Now, all these corneal antigens now will behave like a foreign antigen, and if it is exposed to blood, they will be processed by the antigen presenting cells and human body will start producing both antibodies and cell toxicity in those cells. Hence, suppose there is an injury to one eye with rupture of cornea, uveal tissue, you have repaired it. Now you are expecting that the person has the other eye. If you cannot down regulate this, after some time, the other eye will start showing signs of inflammation, uveitis. Why? Because all these antigens have now been processed and there is immune reaction against the other remaining corneal tissue and the uveal tissue. The same thing again happens with the testis. I think you have heard about torsion of testis. A sudden trauma to the testis may lead to testis trauma. Now, if the antigens, sequestrated antigens, get released during the trauma, again the immunological mechanism will be triggered and the other testis will undergo inflammatory changes called as orchitis. Okay. The next mechanism is called as molecular mimicry. What is mimicry? What is mimicry? Copy kora. Very good. Now what happens is, I have already told you, during the development, most of the cells which recognize self antigens are removed. But some organisms are present, that is the pathogens are present, they have some antigens. When these antigens trigger antibody production, these antibodies can bind with the human tissue also. Okay. This is called as molecular mimicry. Normally we expect what happens? One particular antigen will produce an antibody and that antibody should bind to that antigen only. But some, for example, Group A Streptococci has many antigens like the M antigen, the C antigen. After infection, when these antigens are processed in the body, antibodies are produced. Thereafter, what we can see is that these antibodies will start targeting other tissues, like it may have affinity to the hyaluronic acid. Where are hyaluronic acid present? Predominantly in the joints. There will be inflammation of the joint. It can attack the myocardium and the patient may have carditis. It can attack the neurons. There will be neurological manifestations. However, do remember that all these antigens were earlier processed during the development. But because the group B streptococci have those particular antigens which give rises to antibodies and eventually attacking the human cells, this is called as molecular mimicry. Another mechanism that can happen is called as polyclonal lymphocyte activation. Now try to understand what it is. It is called polyclonal. Polyclonal means a number of type of cells. What are the cells? Lymphocytes. It may be T lymphocyte, it may be B lymphocyte. So what happens is, I think you have heard about super antigens. পড়ানো হয়েছিল তো সুপার অ্যান্টিজেন্স? No? One? Bah. Good. Some organisms like Staphylococcus may produce a toxin that is called as Staphylococcus toxic shock syndrome toxin. Now, what is a toxin? It's a protein molecule. So any protein will act as an antigen. But significance is that this antigen may bind directly to the T cells for production of antibodies without being processed by an antigen presenting cell. That means these antigens can bypass the normal route of production of antibodies. Hence, when a large amount of toxin, this protein or the toxin is present, it can lead to release of severe high amounts of antibodies or activation of the immune system. Hence, these are called as super antigens. Now, these super antigens, they can trigger many number of T cells simultaneously. Normally, if a particular antigen is there, it will be processed by the antigen presenting cell and particular sets of T lymphocytes will be activated. But because these antigens no longer require an antigen presenting cell, they can trigger huge number of T cells simultaneously. So, if huge number of T cells are activated, what will happen? Obviously, huge amounts of antibodies will be produced and cytotoxicity will be seen. Similarly, some viral infections like Epstein-Barr virus, they can trigger polyclonal activation of B cells. What does the B cell do? It produces antibodies. This is the reason why after infections with Epstein-Barr viruses, if we do a serological analysis, all the antibodies that were present previously in that person, every antibody titer rises because there is polyclonal B cell activation. Now, suppose if these B cells, because of any of the mechanism, either loss of energy, loss of T regulatory cells, or say lack of the inhibitory stimulants, if anything happens, all these antibodies will trigger tissue destruction. Understood? Okay. The final mechanism is called as exposure of cryptic self epitopes. What is cryptic? Cryptic means hidden. And what is the epitope? What is an epitope? এটা তো বলা উচিত. What is an epitope? That means it is the present on the antigen. During the development of the immune system, not all epitopes of an antigen are effectively processed in T cells. However, the T cell clones reacting to such epitopes may not be deleted. Some epitopes may be sequestrated and they may not be deleted. When they are further released, then it can cause activation of the T cells. This happens especially after local tissue destruction. It could be a trauma, it could be an infection, it could be even malignancy. When this tissue releases the epitopes. The same thing can happen what is called as epitope spreading. Epitope spreading, especially after molecular microbial infection, the self tissues which were earlier recognized, the epitope changes and can cause reaction of the T cells. Okay. So, this is the gist of all these mechanisms. So, how can the autoimmunity does damage to the human body? First is by circulating auto antibodies. Now, when these auto antibodies are produced, these auto antibodies may trigger complement lysis. You have read the complement system? How does the complement is activated? There is a classical pathway, there is a lectin pathway. In the classical pathway, you can find there is an alternative activation with the immunoglobulin IgG. So, when huge amounts of antibodies are present, these antibodies may get sequestrated to any part of the body, leading to activation of the complement system. This complement system will now cause tissue destruction, or these antibodies may interact with various cells. For example, if it affects the neuromuscular junction, it can lead to a disease called as myasthenia gravis, or it can form toxic immune complexes like in SLE. That means the antibody will bind with the autoantigen and this antigen antibody complexes will be deposited in many parts of the body, and these antigen antibody complexes will henceforth be removed by the complement again. And when the complement remove these antigen antibody complexes, there will be localized tissue damage. Or antibody dependent cellular cytotoxicity. That means there is something called as antibody dependent enhancement. The IgG that is produced, it enhances further activation of the cytotoxic T cells. And finally, penetration into the living cells. This is a controversial topic, I won't go into depth further. The T lymphocytes, what does the CD8 cell does? It causes direct cytotoxicity. And what does the CD4 cells will do? It is the helper cells. It will further accentuate production of the antibodies. Last but not the least, always remember, when the B and the T cells have this kind of mechanism is going on, some of the cells of the innate immune system, like the natural killer cells, the macrophages, the monocytes, they will also be activated by the cytokines. They can again cause tissue destruction. Okay. Now, till now, we have understood about what is the basic concept of autoimmunity, how the autoimmune diseases happen, how the body normally prevents autoimmunity, and how autoimmune reaction occurs. But there lies the question, not everybody is suffering from autoimmune diseases. Then what is the trigger? If we look at the triggers, there are something, please remember, all these epitope sharing, production of antibodies, these are all determined by the chromosome, that is the genes. Whenever there is a mutation in any of these genes, it can lead to autoimmune disease. Okay, every pathway has a positive feedback, has a negative feedback, has a co-stimulatory function, has an inhibitory function, has a regulatory function. All are mediated by proteins. These proteins come from a gene. So any kind of error in the gene may trigger an autoimmune response. These are genetic causes. And why we can say these genetic causes are very directly responsible? Because if we study the population, we can find autoimmune diseases are more common in twins, and even more so in identical twins, more than dizygotic, that is the fraternal twins. Hence, the genetic cause is the most important cause. However, what we have seen that many patients during the development do not suffer from the disease, but as they age, they start manifesting the various symptoms of the disease. If we look at the causes, some of the causes can be attributed like the microorganisms. Some microorganisms can cause activation of the immune system, causing autoimmune diseases. Similarly, there are some microorganisms, for example, many organisms present in the intestine and the stomach, they can downregulate the immune system. When they downregulate the immune system, the activation reduces. Similarly, during our lifetime, we are exposed to many types of xenobiotics. What are xenobiotics? That can cause cell damage, including chromosomal damage, which may include tobacco smoke, ultraviolet light, various pharmaceuticals, heavy metals, and the microbiota, that is the normal flora of the human body, and the nutrition, whatever food we are taking. All these factors are responsible for controlling the autoimmune system. For a look over here, any change either by infection or by a xenobiotic may lead to a molecular mimicry. And after the molecular mimicry, there might be activation of the B or T cells. Any trauma, tissue destruction, injury may stimulate the self antigen, thereby causing autoantigens. Now, let us look at the progress of the autoimmune disease. If we look at the progress of the autoimmune disease, initially, because of there is a genetic predisposition, and then some triggering factor will lead to production activation of the immune system against the body's own cells. Initially, there will be only subclinical manifestation. That means overtly clinical manifestation may not be there. When the reaction becomes substantially high with production of various cytokines, we can find various clinical manifestations, from low grade fever to skin manifestation to say pain in the joints, arthalgia, weakness. All these is seen in the clinical disease. After that, most of the disease may go under remission. That is, the body tries to down regulate the immune status. and when that happens, we can find resolution. So, this is the reason why in most of the cases of autoimmune disease, you will find the patients will having symptoms and then resolution, symptoms, resolution, what we call as waxing and waning. Sometimes this reaction may be very severe and it can also be fatal. Okay. Now, if we have to classify autoimmune diseases, we can classify autoimmune disease into various ways. Let us look at the first way in which we can classify autoimmune disease is based on the type of the organ affected. So, a single organ may be affected or multiple, or say systemic disease, we call it as a systemic disease, and multi-organ. For example, suppose it affects a single organ. Can you give an example? Thyroiditis. Any thyroiditis you know which is autoimmune? কি বলে ওটাকে? So, or আরে এটা বলতে পারবে তো, type 1 diabetes mellitus. So, in type 1 diabetes mellitus, what happens? There are antibodies and cytotoxic effect on the beta cells of the pancreas. The beta cells die and the patient presents with diabetes, whereas single organ is affected. Sometimes, because of this autoimmune disease, multi-organ can be affected, like the good pasture syndrome, where the kidneys and the lungs are affected. Not of the same system, but more than one organ is affected. Or we can find systemic infection like SLE, where many organ systems are affected. Now, these organ systems, when affected, can also affect the, these are also called as collagen disease. Why collagen disease? Because most of them will be affect the constituting part of the human organ system, that is the collagen. Similarly, let us look at the various autoimmune diseases. We can classify various anemias like autoimmune hemolytic anemia, where the antigen is the RBC membrane protein against which antibodies are produced. That is the reason why the RBCs are destroyed. When the RBCs are destroyed, the patient presents with anemia. Or it could be drug induced anemia, or it could be pernicious anemia, where antibodies are present against the cells which absorb vitamin, vitamin B12. So, there will be deficiency of vitamin B12 leading to anemia. Similarly, if antibodies are produced against platelet membrane proteins, the platelet will not be able to function properly and we can find purpura. Similarly, if organs are affected like Graves' disease, myasthenia gravis and good pasture syndrome. Systemic autoimmune disease, I have already told you about SLE. Another example would be rheumatoid arthritis, where the antibody is produced against the Fc fragment of the IgG. IgG is present normally. The fragment of the IgG is the Fc fragment against which the antibodies are produced. Hence, almost all organs are affected. Similarly, we can have Sjogren's syndrome or scleroderma, seronegative spondyloarthropathy, and finally multiple sclerosis. This is the way in which we can classify many autoimmune diseases. Now, coming to laboratory diagnosis, if the predominant modality of the disease is by autoantibodies, we can detect the autoantibodies by various methods including ELISA or CLIA. The antibody detection can be done. Sometimes the antibodies may be deposited on the organ or tissue, or the antigen antibody complexes may be deposited on the organ or tissue. Those can be identified with the help of immunofluorescence on biopsies. These are the few antibodies which are detected. For example, in case of SLE, we can detect the ANA or the anti-nuclear antibody or anti-dsDNA, and in case of scleroderma, anti-SLC70. These are the particular antibodies which can be used for diagnosis. Coming to the treatment of autoimmune diseases. The treatment of autoimmune diseases is somewhat complicated. The first modality of treatment obviously is the symptomatic management. The second modality is the downregulation of the immune system. But here lies the problem. Normally, you will find that the human body will have an equilibrium of immune response and immune suppression, and this can be modified according to the state. If the person gets a pathogen, that is, gets infected, the immune response will increase and the immune suppression will be there. This helps us in getting rid of the pathogen. Now, in autoimmune diseases, what happens? Instead of this normal path, we see the immune response, that is, immune system is activated, right? And if we try to down-regulate or suppress it, we have to give immune suppressive drugs. It could be steroids or any other cytokines which can be given. But what will be the problem? If we increase immune suppression, immune response will go down, making the person more susceptible or more vulnerable to various types of infections. This is the reason why treatment of the most of the autoimmune disease is very complicated. Furthermore, most of the diseases are chronic in nature. However, various specific treatment that can be done with the help of monoclonal antibodies. Monoclonal antibodies, I think, was already taught. You understand monoclonal antibodies? Those monoclonal antibodies are targeted as a blocking agents. They will block and prevent the immune reaction. Regulatory cytokines or CTL4, these can be used for down regulation of the immune status. So that was all about autoimmune diseases.